Visual motion sensitivity and dizziness in large crowds. Any advice? I think this is extremely common for patients. I think the majority of my patients will report dizziness in crowds. They'll also report dizziness in shopping malls and supermarkets, walking up and down the aisles, as well as potentially riding in cars or driving. This is what's called visual motion sensitivity. So if you're somewhere and you see there's a lot of motion happening around you and just your eyes looking at it, and that makes you feel dizzy, you could have what's called visual motion sensitivity. My best advice for that would be to find some sort of therapist who's specialized in concussion rehab and can actually pick apart whether or not it's visual motion sensitivity or whether or not it's something else. And sometimes you just got to go through a process of kind of ruling things out through physical exams and things like that. They'll be able to guide you as to the next steps and appropriate rehab to do. One of the rehab tools, though, that you can use without even necessarily having a therapist prescribe it to you is actually exposure type therapy. So exposing yourself to the stimulus that increases your symptoms is becoming more well known in the concussion space, and it's basically it's habituation and adaptation to the stimulus that is provoking. So if you find that being in large crowds is tough and there's a lot of motion going on, by exposing yourself to large crowds more and more, your brain gets used to that and it stops being so provocative for you. And so that's one of the therapies that we commonly recommend for visual motion sensitivity. But the important part is figuring out if that's actually what it is or if it's something else. Because if it's something else and you're going into crowds, you might not get the benefit that you would, but I don't think it's going to hurt you by doing that. So the big thing with concussion, I think, to keep in mind is that in the post-concussion syndrome phase, in the later stages of concussion, symptoms are not necessarily a bad thing, right? In the acute stages, we tell you to really monitor your symptoms, and anything that provokes your symptoms should be avoided. Well, in the chronic state, we tend to take more of a, if it bothers you, do it more approach, because that can help to habituate and help you to adapt to that stimulus so that it is no longer something that is provocative. So you have to kind of gradually work your way in, and this is where a trained kind of concussion practitioner can help you to be on the right track.